Welcome. Today we'll learn about a medicine called Rovista. Rovista, rosuvastatin, tablets are a synthetic lipid-lowering agent, statins, for oral administration. It is used to lower cholesterol and fats in the blood. How it works, mechanism of action. Rosuvastatin blocks an enzyme in the liver called HMG-CoA reductase. This enzyme helps make cholesterol, so by blocking it, the liver makes less cholesterol. The liver then pulls more LDL, bad cholesterol, out of the blood. It also reduces the production of VLDL, another type of bad fat. Overall, this leads to lower levels of bad cholesterol, LDL and VLDL, and can help prevent heart disease. Package contains. Each packet of Rovista contains 30 tablets of 10 mg and a leaflet. It is also available as Rovista 30 or 10 tablets box of 5 mg and 20 mg. Composition. Each film-coated tablet contains rosuvastatin calcium USP equivalent to rosuvastatin 10 mg. This product contains lactose. Dosage. As directed by the physician or see package insert for full prescribing information. Therapeutic indications, uses. Rovista, rosuvastatin, is indicated for the treatment of hyperlipidemia and mixed dyslipidemia, as adjunctive therapy to diet to reduce elevated total C, LDL-C, ApoB, non-HDL-C, and triglycerides and to increase HDL-C in adult patients with primary hyperlipidemia or mixed dyslipidemia. Lipid-altering agents should be used in addition to a diet restricted in saturated fat and cholesterol when the response to diet and non-pharmacological interventions alone has been inadequate. Pediatric patients with familial hypercholesterolemia, as an adjunct to diet to reduce total C, LDL-C and ApoB levels in children and adolescents 8 to 17 years of age with heterozygous familial hypercholesterolemia if after an adequate trial of diet therapy the following findings are present. LDL-C and GT 190 mg per deciliter or in GT 160 mg per deciliter along with a positive family history of premature cardiovascular disease (CVD) or 2 or more other CVD risk factors. As an adjunct to diet to reduce LDL-C, total C, non-HDL-C and ApoB in children and adolescents 7 to 17 years of age with homozygous familial hypercholesterolemia, either alone or with other lipid-lowering treatments, e.g. LDL apheresis. Hypertriglyceridemia, as adjunctive therapy to diet for the treatment of adult patients with hypertriglyceridemia. Primary dysbeta-lipoproteinemia, type 3 hyperlipoproteinemia, as an adjunct to diet for the treatment of adult patients with primary dysbeta-lipoproteinemia, type 3 hyperlipoproteinemia. Homozygous familial hypercholesterolemia, as adjunctive therapy to other lipid-lowering treatments, e.g. LDL apheresis, or alone if such treatments are unavailable to reduce LDL-C, total G, and ApoB in adult patients with homozygous familial hypercholesterolemia. Slowing of the progression of atherosclerosis, as adjunctive therapy to diet to slow the progression of atherosclerosis in adult patients as part of a treatment strategy to lower total C and LDL-C to target levels. Primary prevention of cardiovascular disease in individuals without clinically evident coronary heart disease but with an increased risk of cardiovascular disease based on age 50 years old in men and 60 years old in women, HSCRP 2 mg per liter, and the presence of at least one additional cardiovascular disease risk factor such as hypertension, low HDL-C, smoking, or a family history of premature coronary heart disease. Rovista, rosuvastatin, is indicated to reduce the risk of stroke, reduce the risk of myocardial infarction, reduce the risk of arterial revascularization procedures. Dosage and administration. General. The dose range for Rovista is 5 mg to 40 mg orally once daily. It can be administered as a single dose at any time of day, with or without food. The usual starting dose is 10 to 20 mg. The usual starting dose in adult patients with homozygous familial hypercholesterolemia is 20 mg once daily. When initiating Rovista therapy or switching from another HMG-CoA reductase inhibitor therapy, the appropriate starting dose should first be utilized, and only then titrated according to the patient's response and individualized goal of therapy. After initiation or upon titration of Rovista, lipid levels should be analyzed within 2 to 4 weeks and the dosage adjusted accordingly. The maximum 40 mg dose of Rovista, rosuvastatin, should be used only for those patients who have not achieved their LDL-C goal, utilizing the 20 mg dose. Contraindications. Rosuvastatin is contraindicated in patients with hypersensitivity to rosuvastatin or to any of the excipients of the product, in patients with active liver disease, including unexplained, persistent elevations of serum transaminases and any serum transaminase elevation exceeding 3x the upper limit of normal, ULN, during pregnancy and lactation, and in women of childbearing potential not using appropriate contraceptive measures. In patients with severe renal insufficiency, creatinine clearance, 30 ml, minimum. In patients with myopathy. In patients receiving concomitant cyclosporine. Concomitant use of protease inhibitors in HIV patients. The 40 mg dose is contraindicated in patients with predisposing factors for myopathy, rhabdomyolysis. Such factors include moderate renal insufficiency, creatinine clearance, 60 ml per minute, hyperthyroidism, personal or family history of hereditary muscular disorders, previous history of muscular toxicity with another HMG-CoA reductase inhibitor or fibrate, alcohol abuse, situations where an increase in plasma levels may occur, concomitant use of fibrates. Asian patient. Adverse reactions. Side effects. Rosuvastatin is generally well tolerated. Adverse reactions have usually been mild and transient. Common: headache, dizziness, constipation, nausea, abdominal pain, myalgia, asthenia, and diabetic mellitus. Uncommon: pruritus, rash and urticaria. Rare: hypersensitivity reactions, including angioedema, myopathy, rhabdomyolysis, thrombocytopenia, increased hepatic transaminases, lupus-like syndrome, muscle rupture and pancreatitis. Drug interactions. Cyclosporine increased rosuvastatin exposure and may result in increased risk of myopathy. Gemfibrozil significantly increased rosuvastatin exposure due to an observed increased risk of myopathy, rhabdomyolysis. Combination therapy with rosuvastatin and gemfibrozil should be avoided. Co-administration of rosuvastatin with certain antiviral drugs has differing effects on rosuvastatin exposure and may increase the risk of myopathy. Darolutamide increased rosuvastatin exposure more than 5-fold and increased the risk of myopathy. Regorafenib increased rosuvastatin exposure and may increase the risk of myopathy. Rosuvastatin significantly increased INR in patients receiving coumarin anticoagulants. Therefore, caution should be exercised when coumarin anticoagulants are given in conjunction with rosuvastatin. Cases of myopathy, including rhabdomyolysis, have been reported with HMG-CoA reductase inhibitors, including rosuvastatin, co-administered with colchicine, and caution should be exercised when prescribing rosuvastatin with colchicine. The simultaneous dosing of rosuvastatin with an antacid suspension containing aluminium and magnesium hydroxide resulted in a decrease in rosuvastatin plasma concentration of approximately 50%. The antacid should be taken at least 2 hours after rosuvastatin administration. The risk of skeletal muscle effects may be enhanced when rosuvastatin is used in combination with niacin. A reduction in rosuvastatin dosage should be considered. Storage instructions: do not store above 30 degrees Celsius. Protect from sunlight and moisture. Please read the contents carefully before use. This package insert is continually updated from time to time. Manufactured and buy online. Rovista tablets are manufactured by Getz Pharma Pvt Limited. It is available online, or you can purchase it from any nearby pharmacy. Rovista tablets, a box of 10 tablets of 10 milligrams, is available at a retail price of around 300 rupees, while a box of 30 tablets of 10 milligrams is priced around 1351 rupees. Thanks for watching and supporting. Take your medicines as your doctor or pharmacist prescribes them. You can check its article at MedsArchive.com. Have you ever used this medication? Please share your experience in the comments. Which medicine should we cover next? Your suggestion could be our next video. MedsArchive 1.